The overdrugging of nursing home residents is one of the most common forms of elder abuse. Nursing homes and doctors often use drugs to sedate, subdue, and chemically restrain elderly residents with dementia. On any given day, over 25,000 nursing home residents in California receive at least one antipsychotic drug. What are antipsychotic drugs, and why are they so prevalent? There are many antipsychotic drugs. Some of the more commonly used are Haldol, Zyprexa, Risperdal, and Seroquel. These drugs are powerfully mind-altering and have severe side effects. For elderly people, they can be deadly. There are several problems with the way nursing home residents are given antipsychotic drugs. For one thing, the drugs are used off-label. That means that antipsychotic drugs have not been approved by the FDA for the treatment of dementia. In fact, the FDA has issued its most dire warning, known as a black box warning, regarding antipsychotic drugs. The warning states that antipsychotic drugs can almost double the risk of death for elderly people with dementia. The FDA has also issued an advisory to doctors, informing them elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. Antipsychotic drugs are not approved for the treatment of dementia-related psychosis. Healthcare professionals should consider other management options. Despite laws requiring they be informed, nursing home residents and their family members almost never see these warnings. In fact, antipsychotic drugs are often given to nursing home residents without their knowledge at all. If antipsychotic drugs are really dangerous, why are they so often being given to elderly residents of nursing homes? One reason is drugged, docile residents allow nursing homes to reduce their budget for staff, saving money and increasing profits. Important laws exist to give nursing home residents and their families control over the care they receive. Unfortunately, enforcement of the laws has been extremely lax. That is why residents and families must be active in demanding that antipsychotic drugs never be used unless they are absolutely sure that there are no less dangerous alternatives. Here are a few important tips on stopping misuse of antipsychotic drugs. Periodically request a complete list of current medications. If antipsychotic drugs are proposed, ask why they are justified and what alternatives have been tried. Don't consent to antipsychotic drugs unless you are certain that all other care and treatment options have been exhausted. Do not give consent to antipsychotic drugs if the doctor has not directly examined the resident to determine the need for the drug. Insist that the doctor or nursing home provide written information on adverse consequences of the proposed drugs, including black box warnings. For more information and advice, read our guide, Toxic Medicine, which gives additional information on antipsychotic drugs and how to challenge their use. California Advocates for Nursing Home Reform has launched a campaign to end the misuse of psychoactive drugs in California nursing homes. If you would like to join our campaign or would just like more information about drugging and what you can do about it, please contact us.